Well, it is the last day of the 10-day Write Your Birth Plan with me, and it's been a blast. Thank you so much for everybody who's joined me along the way. Before I do a wrap up, I just want to finish the last day, which is talking about your placenta. And of course, I have a placenta, not a real one, but my little placenta that I use, which ideally, and this is what we discuss in detail, is about making sure that after your baby is born and brought up to your chest and kept skin to skin, that we keep the placenta attached. Now, obviously, this would still be in your belly, but we want to make sure that we allow the attachment to stay in place for at least 2 to 5 minutes to allow the blood flow that is in the placenta to get to the baby. Okay, so we discussed delayed cord clamping and the importance and relevance of delayed cord clamping, when it should be done, the reasons that sometimes hospitals don't do it, and the importance of discussing with your care provider what the practice is in the hospital or the place where you're going to be giving birth. Remember that it's not unheard of for you to take information in to share with your care provider, although they may be up to date with the latest changes and evidence showing that delayed cord clamping is the optimal practice. They may not have changed the policies and the procedures or the policies in the hospital or the place where you're working yet, and they may still be operating under old-fashioned and not best for you practices. So it is important for you to take the evidence with you. So you're going to have your baby on your chest, placenta is still inside, and ideally, well, we discussed the two ways, which is the physiological third stage, which is waiting and allowing the placenta to come out on its own, which it would naturally do given time, usually 10 to 15, possibly up to 20 minutes. And the presence of your baby on your chest and the kicking of your baby against your belly, and possibly even if your baby's moved down and started breastfeeding, will aid the hormonal release that gets your uterus to contract and will aid in expelling the placenta. If for some reason the placenta does not come out on its own, or if there is a complication requiring active management of the placenta, then you will be given an injection of syntocinon, otherwise known as Pitocin, which would do the same thing as your natural hormone oxytocin, which would stimulate the uterus to contract, usually quite powerful contractions, getting the placenta to come out. The birth of the placenta is not, it's, when we think about, you think, oh my goodness, you've just given birth to a baby. Now you still have to give birth to placenta. Remember that the placenta is soft. It's soft and pliable, and it may look like big, but it's going to come out all folded up, and it is soft. So most ladies don't really feel it. They're so wrapped up with what's happening over here that they're not they're not really going to feel it. So it's not going to be any more painful, and it shouldn't be, than giving birth to your baby. So we discussed this at length, and the importance of talking about delayed cord clamping and whether or not you're going to have a natural physiological third stage, because the delivery of the placenta is termed or talked about and called the third stage of your labor, or if it's going to be actively managed, and the benefits, alternatives, risks, as always, of those two. So in saying that, as I mentioned, that brought us to the end of the 10-day birth plan. And just to wrap up and kind of go through all the things that we've done and the things that we've used, you've seen that I've had all the tools and gadgets, starting off with my pelvis, so that you have a deep understanding of the hard structures and the way that your baby moves through. We've worked with my little knitted uterus and the cervix. We've worked with a balloon with a ping pong ball in it, showing the difference between Braxton Hicks contractions and your normal uterine contractions. We've had my lovely little model just showing the basic anatomy of the reproductive system and the way your baby fits, the way your baby moves. We've had our little baby. I'm just showing you about placenta. And I've used several books. And this is something I think there's always value in using lots of different schools of thought so that we don't get stuck on one particular thing, and understanding the value of reading a lot about childbirth and different women's perspectives and understanding of childbirth. And in her book, The Experience of Childbirth, is a wonderful resource for anybody who is pregnant and a great starting place. The second one that I highly recommend and that I use extensively is Ina May Gaskin and Spiritual Midwifery. I had the pleasure of meeting Ina May at a conference a few years ago, and it was wonderful. One of the pioneers, Grantley Dick Reed, and his book Childbirth Without Fear, also a really important one to read. When he talked about breathing, I used the book Mother's Breath by Uma Dinsmore Tully. Not necessarily a book that you're going to read from cover to cover, but one that will give you a lot of insight into breath and how breath can help you. Another wonderful midwife that I also have the pleasure of knowing and working with, Robin Sheldon and the Mama Bamba Way, a beautiful book that I do recommend reading from cover to cover, and one that will give you deep insight into the intimate connection between you and your baby, and a beautiful aspect of pregnancy that is very often overlooked. Highly, highly recommended. Pam England and Rob Horowitz and their book, Birthing from Within. There's some beautiful exercises in here. Also, once again, another way of approaching your pregnancy, and as the title suggests, looking at and working with your pregnancy from the inside out rather than the outside in. I love what she does with birth art. I love her aspect and understanding of birth plans. And another book that you can dive into and use at random. And then another one that I don't have with me at the moment, but that we've used extensively. Sorry, I can't even remember what it was. Completely slipped my mind, and because I don't have it. So that's that. The 10-day birth plan with 25 amazing ladies who have all contributed wonderfully to creating their birth plans. And what's so lovely about it is that at the end of it, all of their birth plans are completely different. And I have no doubt that when they do go on to have their babies, that their birth experiences will be completely different. And that is why this work is so important, because you are unique, you're individual, you have different beliefs, expectations, you're in different countries, and you want different things for your babies. You're working with a different team, your partners are different, your families are different, your upbringing, everything. And so we take all of those things into account, and I've helped the ladies craft a birth plan and an understanding of 10 of what I consider the essential elements of understanding and preparing for your birth, and how they can weave that into their own preparation and then present that to their care provider, to their partner, and work to have a safe, gentle, and beautiful birth that will be a lasting memory in their life. So thank you for joining me. There's a lot more to come about this, and I will be sharing in the next couple of weeks.